Hello and welcome to the October 2022 Longevity Review, presented by the Canadian Longevity Association, a federally incorporated nonprofit whose mission is to accelerate the introduction of effective longevity treatments and to ensure their free availability to all Canadians under the provincial healthcare systems. My name is Chris Linnell, and I am the founder and president of the association. We are a volunteer-run organization and are just starting out. So we could certainly use your help regardless of your skills or time availability. If you would like to help us achieve our mission, then please fill out our volunteer registration form, which you can see here, or contact us via our website, or indeed from our Facebook group page. I'd show you that, or Twitter itself, where you can access via my own personal site, or my own personal site, or that of the association. So moving on, after that shameless plug, I'm currently conducting a rapamycin trial. Actually, I took the last dose yesterday. However, I will be doing a separate video series on this, so you can find that on our YouTube channel as well. Okay, moving on to the October 22 roundup, which pulls together what I believe are the most important and significant publications of the month. And starting out with actually a publication which I think will certainly be in the top 5 of the entire year. And this publication involves the combination of two of the hottest fields in longevity research or longevity science, that being senolytics and partial epigenetic reprogramming. So just a little bit of background. Senolytics is the removal of senescent cells. And what are senescent cells? Well, senescent cells are malfunctioning cells in our bodies, which normally would be removed, but unfortunately they kind of hang about a bit like zombie cells and cause problems for our bodies. And if they're taken out, it appears that well, it provides numerous benefits, as scientists are discovering. And partial epigenetic reprogramming. So the epigenome are the marks on our genome, which basically tells a cell, that it's a liver cell as opposed to a brain cell or anything like that. And whereas our genome stays the same throughout our lives, these markers on top of the genome change over time. And the idea with epigenetic reprogramming is if that we could reset those markers to a more youthful level, then the cell might behave more youthfully and basically be rejuvenated, which is what happens when with induced pluripotent stem cells, which are basically rejuvenated all the way back to the time of an embryo. Anyway, so these are the two hottest fields. Senolytics sort of was hogging the headlines the last several years. Epigenetic reprogramming has been the really flavor of the month for the last year or two. Interesting studies have been coming out in both those fields. However, this is the first study which involves the combination of both of these techniques. And if you've read or heard me before, I keep on going on about how that longevity will not be achieved, or rejuvenation will not be achieved simply by one method. It's going to involve the combination of numerous methods to yield synergistic results. And that is exactly actually what just happened here. So these experiments were done in flies, so still a long way away. And also the epigenetic reprogramming involved the use of genetic modification to those flies. However, a couple of those papers coming out this year have shown that there are now potential sort of chemical or druggable means to achieve the same effect. So, which means that it's looking increasingly likely that this can be translatable to humans. But let's look at the results when they combined senolytics and partially epigenetic reprogramming in flies. So let's open up this figure. Hopefully you can see this okay. So they used three different sort of modalities. One where they continuously expressed these reprogramming factors and continuously expressed senolytic treatment. And well, it turned out to be bad. You can see this outside line is the control, and then hold on, the red is just the reprogramming on its own. It's actually hard to see the colors. The green, no, sorry. Yeah, the green is senolytics on their own, and the sort of the bluish line in the middle is the combo. But as you can see, all three are worse off. However, when they transiently expressed both the senolytics and the reprogramming, either in two 24-hour cycles per week or two 12-hour cycles per week, they showed benefit, because now the control line is this sort of, again, this is the purple one on the left. And that turned out that actually expressing it for only 12 hours twice per week showed the maximum benefit. So I'll concentrate on that. So you can see here that the control line on the left, as the probability of death increased. The green line here is senolytics. So it shows that, senolytics improved the average, kept more flies alive for longer, but then there was a quite steep drop off in their deaths. With reprogramming, which is the red line on its own, it sort of shifted the entire curve to the right and increased maximum lifespan, which again did not happen under the senolytics, and in fact a tiny decrease, it looks like. However, when both were combined, so this is this outside bluish line, you can see that this recapitulated the benefits of both. Not only did it sort of push out the number of flies surviving for longer, but also increased maximum lifespan. So, very exciting results. This is the first time this has been done. I'm sure the methodology, all this can be improved. So you might be saying, well, that doesn't seem like a huge big increase, but hey, we'll take whatever we can get, is my opinion on this. And again, this is very early days. And so there's a lot more progress to be made. But as a sort of a proof of principle, this is incredibly exciting. On to the next paper. So this actually, we're sticking with the epigenetic reprogramming or cellular reprogramming here. As in this study, scientists, here we go. Scientists actually use a type of rapidly aging mouse. So not a normal mouse. Actually, again, this is in mice, not flies anymore, so more relevant to us. However, so these weren't normal mice. They were genetically engineered, but to basically age faster. But however, they found out that when either they continuously administered the epigenetic reprogramming, but at a very small, low level, or administered it only for the first couple weeks in life, it showed a number of improvements. So the mice the mice lived longer. If as you can sort of see by the green lines here, and which figures am I looking for? Yeah, various market. Well, won't go into these details here. Basically, the mice seem to live around 15% longer, and also various markers for yeah, there was improved fitness, skin. Further on, hold on. Yeah, they had improved fitness. Their skin regenerated faster, and I don't seem to see it here. And there was improvements in their lungs, spleen, and kidneys. Hold on, is it here? Looking at lifespan.io. So in all, whenever lifespan.io has a write-up of the research, I always include it. That was a different paper I was thinking about, which had better figures. But yes, anyway, short-term induction early in life had a improvement in maximal lifespan. Once again, this is one of the first studies showing lifespan improvement in mice in cellular reprogramming, so which was the significance of this study. But mind you, again, these were genetically engineered mice, but again, it's early stages here. So regardless, a promising study. And in addition to that, a third epigenetic study. So this is not about epigenetic reprogramming, but epigenetics can also be used to find out people's sort of true biological age, not just chronological age, because epigenetics have been used to create biological clocks. And if people are aging more slowly than the average, they've got a better epigenetic age, and well, they are, as I just said, they're aging more slowly. And in this study, it was basically looking at the epigenetic ages of centenarians, people who make it to 100. And maybe quite unsurprisingly, it turns out that centenarians, people who manage to reach 100 years of age, have a younger epigenetic age than their chronological age. So again, it's unsurprisingly, since they managed to live so long anyway, they seem to be aging more slowly, at least by this epigenetic measure. So again, just showing that if we can do something about the epigenetics, then that can have useful health benefits for us, or help us live longer. Because one thing about centenarians is that yeah, they're for the most part they get diseases later. They're less frail. They're more robust. They have higher quality of life for much longer. Okay, so now moving away from epigenetics, another study, this time looking at extracellular vesicles. What on earth are they? Well, basically, all cells sort of communicate with each other by sort of releasing these tiny packets of information. What I mean by information is sort of signaling molecules. And it's sort of turning out that one of the benefits of stem cells, because for a long time people have been trying to inject stem cells or use stem cells for beneficial effects, and scientists were discovering that they sort of had transient or short-term beneficial effects, but quite quickly the stem cells died off. And it wasn't because the stem cells were producing new tissue and stuff. It was that before they died off, they were releasing these signaling molecules, which had beneficial effects on the surrounding tissue. And rather than injecting stem cells and having them release their cargo, the idea is with extracellular vesicles is to basically, you can grow stem cells in a bioreactor and stuff like that. Is to sort of harvest the extracellular vesicles that they release and use those instead. And much maybe unsurprisingly, the extracellular vesicles from younger animals or younger tissue are better than those produced by an older animal or older tissue. And here in this study, so they used, took, I say these, I call them EVs from now, rather than saying that in mouthful. They took EVs from the stem cells found in adipose or fat tissue in younger mice and gave them to older mice, and this resulted in pro-regenerative effects and a decrease in oxidative stress, inflammation, and senescent markers in muscles and kidneys. Moreover, the predicted epigenetic age was lower in tissues of old mice treated with these EVs, and their metabolome changed to a youth-like pattern. So, actually, this is the study I was looking for the graphs here. So here you can see left is black or left is control, red is these EVs, and so grip strength improved 14 or 30 days after treatment. Motor coordination improved. Fatigue resistance improved. Their frailty score, well, it got worse for the regular mice and disappeared for the other mice. You can see here that their hair regrowth seemed to improve, and their plasmatic urea, I'm not sure what that is exactly, improved as well. And here's a sort of the kidney functions and muscle functions and stuff improved. Basically, you can see on these. What's this now? Yeah, again, more stuff about the kidneys and muscles. Obviously, won't go through all the details here. You can peruse these at your leisure if you so wish, and showing that the epigenetic clocks also improved. So again, this is a modality completely different from the senescent cells and epigenetic reprogramming. Again, it would be interesting to see if something like this were added to that previous regimen. Though I guess you could say that previous regimen needs to be tried out in mice first, which I'm avidly waiting for. But yes, I say EVs are a very promising near-term treatment, I would say. When I say near-term, within the next 10 years, I think these types of treatments should start becoming available. They probably are actually available in some clinics somewhere, though I would, of course, wait until human studies are concluded before jumping in on anything. However, here is the final part of the roundup. Here is one human study, which has much nearer applicability. So this is involving using a probiotic, a Lactobacillus plantarum OLL 2712. Remember that. Which was given to older adults and which improved their memory function. So this was a small study. I believe 78 people took part, and they're basically given this probiotic, and it took place, I forget how, over the period of time. But basically, the composite memory and visual memory scores improved. Inflammatory bacteria in their guts improved, and also a marker of inflammation, IL-10, improved. And so yes, it seemed to, well, as I say, it seemed to be an improvement. I won't try to dig into the details here, but again, here it is. Intakes, had a significant positive effect on the change in composite memory score. Excuse me. And yeah, so as I say, this is the type of thing we always already, if you go into your grocery store and go to the yogurt aisle, they talk about, there's active bacterial cultures, and they put, I think, lactobacillus, or there are various probiotic bacteria which are already put into yogurts and certain drinks. So it doesn't strike me as being that difficult for some company, and perhaps food microbial. I don't know if that. No, I was just looking if it was a company, but it wouldn't strike me as being that difficult for a yogurt company to put a strain such as this into their yogurt or probiotic drink. So watch out in your grocery aisle in the your yogurt aisle in the near future. Okay, moving on to the supplemental section where the majority of these publications reside, and go through these relatively quickly here. So just starting with a intermittent fasting study, which is quite interesting. So intermittent fasting means that you're not eating food during certain periods of time. Not fasting for a long time, but anyway, here they use the 16-8 protocol, which involves every day only eating during an 8-hour window between your first and last calorie of the day, and therefore fasting for the remaining 16 hours, which is actually kind of what the protocol which I employ. Maybe not as strictly. Sometimes it's more like 14-10, but still I try to fast for at least 12 hours every day. And what made this interesting is that a small study, only I think 30 individuals completed this study, but they were all healthy individuals. So this wasn't diseased people. This is maybe more representative of the type of people who are actually trying it out themselves, such as myself. And there was, over 3 months, there was a quite improved, there was an improvement in sort of quality of life. As it says here, results of the WHO-5 questionnaire demonstrated a significant increase in quality of life. For long-term quality of life, 6 out of 8 domains measured by the short form Health 36. Whatever, it's just a questionnaire, significantly improved. So physical health, mental health, body pain, also fatigue significantly decreased, and mental fatigue as well. And also there was a significant reduction in IGF-1, I believe insulin growth factor 1, which lower levels are better. Let's see, is there a graph? So you can sort of see here, make that a bit bigger for you. So just a graph, the blue showing before, the red showing, the orange showing afterwards, and all these markers, be it from pain to vitality, emotional well-being, at least according to these questionnaires, people seem to indicate an improvement afterwards. So if you're and they break down these things here. Yeah, so so if you're looking for better emotional well-being, better quality of life, or reductions in fatigue, it's nice to see that this study seems to agree that that is a good thing. Okay, now the couple studies, also sticking with calorie restriction or intermittent fasting, but specifically looking at the time of day. In that previous study we just looked at, the participants could choose when they ate for their 8 hours. However, when you eat at night, when you eat during the day or night, seems to be important as well. And unfortunately, I say unfortunately because I tend to be a late night eater, or I have been in the past. It's looking like eating earlier in the day or having your eating window earlier in the day is better, or the reverse being eating later at night is detrimental. And I mean, I used to be someone who might only start cooking at 10 p.m., eating my dinner at 11 p.m. So I've been trying to reduce or finish my eating earlier because of the increasing number of studies I've been seeing, of which these two join. Basically, these were more about looking at weight loss and potential for diabetes, but basically, as it says here, eating late increases hunger, decreases calories burned, and changes fat tissue, not in a good way. Or late night eating leads to weight gain and potential diabetes. Let me just open it up. So yeah, I mean, just looking at the graphical abstract here. So eating later, yeah, your metabolic rate goes down, so you body torque. Oh, hold on. Yes, so I guess basically you're burning less calories, you're feeling hungrier, your ghrelin leptin levels aren't correct, autophagy goes down, GF-beta signaling goes down, lipid anabolism, basically the storing fat, goes up. So yeah, various things become worse by eating late, and similar to let's look at the abstract for the others, the second one. So here it's saying that, well, basically saying that it reduces time restricted feeding reduces obesity by burning fat. That is what adipocyte thermogenesis means. And yeah, basically, if you eat earlier, you maybe burn more fat and become easier to lose weight. And unfortunately, weight is aging. You age fat. The more weight you carry, unfortunately, the faster you age. So if you're wishing to lose weight, try to finish eating earlier if you can. I'm looking at a couple, going to diet here. Again, to go through these briefly, but here a big study using the UK Biobank, which has over 500,000 participants. And they're looking at their consumption of beer, wine, and spirits. And it turns out, maybe unsurprisingly, but beer and spirits are more likely to lead to weight gain, whereas wine doesn't. Basically, yeah, there's a reason. I guess we talk about beer bellies. We don't talk about wine bellies. But yes, this is what this observational study showed, but still interesting nonetheless. And secondly, another study, won't go into it, but seems to indicate that having a low carb diet, if you are in the pre-diabetic range in terms of your blood glucose and HbA1c levels, by having a low carbohydrate or low carb diet, those markers sort of improved and maybe cut their risk of diabetes. Though I believe this was a small study. Yeah, small study, but still. See if that was summary up. Yeah, I mean, only reduced HbA1c by 0.23%, but or percentage points, I should say. But still, that could be the difference between being diabetic or pre-diabetic and of normal blood glucose control. Okay, moving on to exercise here, and just very briefly say that the researchers termed them activity snacks following meals may help maintain muscle mass. So it basically talked about reducing your sedentary time, after a meal, standing up, maybe doing some squats, doing just a bit of exercise seems to maintain muscle mass. And that's another thing we are discovering in the last little while, is that maintaining muscle mass is incredibly important. People with greater muscle mass, greater muscle strength later in life are less frail and have lower mortality rates. So certainly one of the reasons I've sort of taken up resistance training myself, or more so than in the past. Okay, moving on to the supplements, non-prescription supplements this is. And here's a small study looking at astaxanthin, which is a carotenoid, so like carrots and stuff, but found in marine animals. And in fact, the reason it's sort of pink orangey color, which is the reason why shrimp, crabs, and salmon are the color they are, is because of the astaxanthin that they are eating. And in this study, only again a very small study, 24 participants in Japan, they who consumed 24 milligrams of astaxanthin for 16 weeks. Their 6-minute walk test, which is a marker of 6-minute walking test, which is a marker, well, I guess endurance and strength and stuff, significantly improved. So the distance they walked significantly improved, and the lactic acid, which can impair muscle function, decreased. Their actual muscle strength and muscle size didn't improve, but yeah, I take 8 milligrams of astaxanthin every day. But yeah, I'm thinking about getting my parents on astaxanthin. Especially my mom. My mom complains about fatigue and not having endurance, so to speak. So again, simple supplement. Again, very tiny study. However, I should emphasize 24 people. I think only 12 of those, were taking astaxanthin, but still, it sort of ties in with other studies I've seen. I think last year I saw a study with astaxanthin improved the distance or endurance for male professional cyclists. So useful for exercise, not only in the elderly. Okay, going on. Too many to do. Yes. So here, looking at vitamin D, and here 2 studies came out looking at vitamin D and mortality, and having a sort of not love-hate relationship with vitamin D. I was sort of very high on vitamin D, not the right choice of words there, in the past, and I was taking up to 4,000 IUs of it. But then a number of studies came out showing that sort of adding extra vitamin D, if you've got enough levels, if your levels are sort of good enough anyway, don't seem to make a difference in various diseases. However, this study, again, using the UK Biobank, and so looking at almost 445,000 people, for those who, in a follow-up time of 11, almost 12 years, people who took vitamin D supplements had a 10% reduced all-cause mortality. The 5% there was people taking multivitamin supplements. And not only that, the regular vitamin D supplement users had an 11% lower cancer mortality rate, an 11% lower cardiovascular disease mortality rate, and a 29% lower respiratory disease mortality than non-users. And sort of ties in with the second study, which also used the UK Biobank data. And here, basically, they just looked at vitamin D levels in general, and those who had levels below 50 nmol had higher rates of mortality. In fact, people who had half that level, 25 nmol, had, excuse me, their all-cause mortality increased by 25%. Though above 50 nmol, there didn't seem to be any increasing benefit. So, I mean, a few years ago I was taking 4,000, then I sort of reduced it to 2,000. Now I'm only sort of taking 1,000 IUs, international units. That's IUs, that stands for. And my level, my last blood work a week or so ago was something like 85 or something like that. So it is fortunately in the good range, but there's certainly no, it's looking like there's no need to sort of massively overdose, because vitamin D has toxicities if it is too high, the levels are too high. So as long as you can get above 50, then you should be okay in this regard. So, maybe taking 1,000 a day could be useful to make sure that you are not below, because unfortunately, it's looking like most people are, where do they say it? Most people are, yeah, so here it is. So the majority had either vitamin D deficiency or insufficiency. So most people are below the 50 cutoff threshold. So it could be worth supplementing moderately with vitamin D. Anyway, I'm sticking at my 1,000 a day level. Come back to this. Just wanted to also show just an observational trial. Again, nothing new here, but the fact that this was a meta-analysis of various trials, and showing that lowering blood pressure can prevent dementia. I mean, keeping your blood pressure under control is very important. Please do check that and take preventative action if your blood pressure is too high. But what they basically found out was that a 10% reduction in systolic, always get systolic, dystolic, basically the top number, I don't know, number could be 120 over 80 or 160 over 100 or something. Anyway, 10 it's measured in milligrams or milliliters, whatever. A 10 reduction in that first figure results in a 13% reduction in dementia. So just yet more evidence. And again, something that there are good, if you can't do it through lifestyle, there are good blood lowering medication out there, which also in some cases, like ACE2 inhibitor, captopril, which we saw last month, extends mouse lifespan. So there are other benefits as well to controlling your blood pressure. But here, I wanted to just to finish off with, I wanted to point out this little bonus subsection, because on SGLT2 inhibitors. Now, what is an SGLT2 inhibitor? Well, it's a diabetes medication, which basically causes you to pee out more glucose, more sugar. So rather than taking it into your body, you sort of or it removes it faster. I don't know the exact biochemistry of it, but yeah, it reduces glucose levels in your body, and they are a recent addition to the diabetes armamentarium. I think they've only came out in the last 10 years or so, but they are very beneficial for diabetic patients, and also then in some of the huge trials that took place to make these um, available, people also discover that they are protective for cardiac and kidney function. So, and these four studies all sort of back this up in their own way. So the first one is a meta-analysis looking at 4 trials with 4,000 participants, and they basically found that they do provide cardiorenal benefits, but important thing here is in patients without diabetes. So of course the question could be, oh, are their SGLT2 inhibitors are clearly good for people in diabetes, but what if you don't have diabetes? Could they still provide a benefit? And the answer appears to be yes. So there was I believe, overall 15% reduction in cardiovascular death, 12% reduction in sort of renal, sort of kidney mortality, and I think 21% overall. Yeah. 0.79. So it's a composite cardiovascular outcomes. So that's out of like 100. So, hence 21% reduction. And here's the cardiovascular death, 15% reduction. And hospitalization for heart failure, well, that's, 28% reduction if my math is correct. And even better, 36% for the composite renal outcome, though that had low certainty. However, again, useful, good that this is showing a benefit in non-diabetics. And again, this is a large study, almost 9,000 people, or an analysis of 4 studies with a total of 9,000 people. So much more significant than when previous when I talked about 24 people or 78 people or something like that. Large numbers lead to more robust outcomes. The second study asked whether or not these drugs were also good for older people. And cut the long story short, they thought that it was. So especially people who are older. So, SGLT2 inhibitors should be considered a valid therapeutic option for older, frail adults with or without diabetes. I think they are concentrating on people who were over the age of 75. But they were well tolerated in frail older adults with or without diabetes, with a low risk of serious adverse effects, and that they have the potential to provide early clinical benefits because supposedly they are fast acting and improve symptoms and outcomes for this population. As it says here, the benefits include reducing the risk of cardiovascular death, all-cause mortality, major cardiovascular events, hospitalizations for heart failure, and progression of renal disease. Looking at the last one first, once again, they looked at it and said that there are benefits for their use, and they were signifying that there was maybe another mechanism by the fact that these new drugs sort of recapitulated the effects of calorific restriction, in that they boosted autophagy, which is the recycling mechanism in our cells, and reduce nutrient signaling, which is a good thing. But finishing off with this final study here, it says repurposing SGLT2 inhibitors to target aging, available evidence and molecular mechanisms. So you want to see why these are potentially useful for targeting aging. This paper goes through them, and I wanted to take a look, finish off with finish off this little diagram here. So again, the mechanism involves the elimination of glucose, which leads to average calorie loss of 200 kilocalories per day, which leads to lower insulin secretion and increasing the glucagon insulin ratio. Increases ketogenesis, which like ketones are another mechanism, another source of fuel for our bodies that does not involve sugars. In fact, when we burn fat, we use ketones. And so, fatty acid oxidation, basically burning fat. All these things increase, which leads to reduced cellular senescence, improved mitochondrial function, reduced reactive oxygen species, so free radicals. Inflammasome goes down, again, pro-inflammatory pathways like IL-6 go down, AMPK goes up, mTOR goes down, which are all good things, which leads to lower decreasing inflammation, and as a result, lower age-related diseases like heart failure, kidney disease, atherosclerosis, hepatic steatosis, so fatty liver, new onset diabetes, and all-cause long mortality, which could lead to increased longevity and health span. So one time only, these new drugs, or these drugs, got their own little subsection. And certainly if you are diabetic, it could be worth talking to your healthcare practitioner about getting on these bad boys. Yes, if you're of more advanced age and are having issues with your heart, actually they're now being indicated for heart failure anyway. So, but yes, a positive note how sort of drugs are being repurposed, drugs which are used for one specific disease. It turns out, and this has been actually a hypothesis of mine for more than 20 years, but drugs which are treating a disease, it turns out that they're, yes, they're treating that disease, but they're treating it by affecting the aging process itself. That's how that disease is being treated. But a lot more still to learn. Anyway, that's reached the end of my talk through this review. As ever, I love to get feedback, and also if you have any questions or anything like that, please do get in touch. If you're seeing this on our YouTube channel, please write a comment below and make sure you like this video. Such as doing that, maybe we'll actually get some revenue from YouTube if more than 4 people have watched this. Anyway, take care, stay safe, and thank you very much for joining me. Till next time, bye.